I hope this is okay that I do it this way. I don't have anybody home to record for me, but here's my presentation. I decided to do mine on trauma care. Ever since I'd visited the surgical critical care unit, I thought that it was really neat how they do things. The care that they give is much different than what you would get in a clinical setting or even on just, for example, the orthopedic floor. I really liked how they were so dependent on the nurses, the doctors were, to give them step by step and also making the decisions that could be life-saving to a patient. So what is trauma and where does it happen? Trauma is a physical injury that causes damage to any cell to tissue level of the body. It also damages organs. The biggest organ that is at risk is the skin. It can also be head or facial trauma, thoracic, spinal trauma, abdominal, and there's also musculoskeletal trauma. It can occur anywhere in the body. It'll occur in the skin, the tissues, the muscles, the body cavities, organs, and the skeleton. Burns are classified in 3 different stages. There's stage 1, 2, and 3, depending on how deep the burn goes into the skin and if it affects the muscle tissue or not. There's also blunt force trauma, motor vehicle accidents, which account for quite a few of the traumas that they deal with, which actually can be lowered if people use their seatbelts properly or if they have children and they have their car seats installed properly along with the child in their car seat properly. Domestic violence is another way that somebody can receive trauma. Sports injuries, more that can fall along the line of concussions, which can lead to a traumatic brain injury is a type of concussion. Spinal injuries, it could be chest injuries, more so of the head and the brain injury though, due to impact force of sports such as hockey and football. Falls. If you are working in a construction site and you fall off a ladder, your chances of receiving some sort of trauma are quite high when you fall. Ballistic is if you suffer from a gunshot wound. Soft tissue and skin trauma. There's different types. For example, an abrasion would just be a scratch on the skin. There's a laceration, which would be opening the skin up. A contusion, which is a bruise. Stab wounds. A cut, which is basically a clean laceration of the skin. A surgical wound. Thermal wounds, which would classify as a burn and also frostbite. Chemical burns, bites and stings, and electric trauma from somebody who's either hit by lightning or gets shocked enough that it causes trauma to the body. Some signs and symptoms are pain, redness, swelling, bleeding, fever, drainage from the site, and heat, which would indicate that there's some sort of infection going on. Complications would be the infection, inflammation, scarring, and loss of function of the injured area. If it goes deep enough to go into and damage the nerves, then that person will more than likely lose function of that specific area. Types of diagnosis. They diagnose by a physical assessment, vital signs sometimes, MRI, CT scan. That would depend on how deep the trauma is. X-ray. They also do an examination of ears, nose, and throat, and they'll do a full skin assessment along with a neurological assessment. The goals and the treatment are to prevent any type of infection. You would probably receive medications depending on the trauma, either antibiotics to treat or prevent infection, or there would be some sort of pain control depending on how severe the trauma is. Should always practice aseptic technique in order to avoid an infection as much as possible. You are going to want to do cessation of bleeding because the sooner you get the bleeding stopped and get it clotting, then there's not so much of a risk of them bleeding out and hemorrhaging. Surgery may be required, especially if it's a burn victim. They more than likely will have to have their burns debrided, and then they possibly will have to do skin grafts. Importantly, client education is extremely important, especially signs and symptoms of infection or worsening symptoms. And ice or heat application may also be used in some instances. For facial and head trauma, the number one head trauma is concussion, which can happen from falling, it can happen from sports injuries, it can happen from a vehicle accident. Also, traumatic brain injury, which is a type of concussion. Hematoma, where there's bleeding on the brain. Cerebral edema, which would be swelling of the brain. A skull fracture. Anything that can happen inside your mouth, whether it be your tongue, your throat. It could be your teeth, your eyes, your airway, and your ears. Some signs and symptoms of a brain injury would include confusion, depression, dizziness, balance problems, double or fuzzy vision, feeling sluggish or tired, headache, memory loss, nausea, sensitivity to light or noise, sleep disturbance, or trouble concentrating or remembering. When somebody should seek emergency care, these are what you would see, and you would direct somebody to seek emergency care immediately, would be changes in pupil sizes, clear or bloody drainage from the nose, mouth, or ears, convulsions, distorted facial features, facial bruising, fracture of the skull or face, impaired hearing, smell, taste, or vision, inability to move one or more limbs, irritability, lightheadedness, loss of consciousness, decreased breathing rate, restlessness, clumsiness, or lack of coordination, severe headache, slurred speech or blurred vision, stiff neck or vomiting, sudden worsening of symptoms after initial improvement, swelling at the site of injury, and persistent vomiting. Diagnosis can be done by an MRI or a CT scan, an X-ray, a physical examination and assessment, specifically a neurological assessment to see, if they have any feeling in their feet, if they're able to move their legs, if they have the correct motor skills. You'd also do a Glasgow Coma scale to see how orientated they are. Treatment might be along the line of surgery. I put the ABC in because especially with a head injury, you're going to want to make sure that their airway is open, they're able to breathe, and that circulation is maintained. The most important thing overall is stabilization of the injury site, because even moving them wrongly one little bit of a way can kill your patient. Medications, there could possibly be maybe a diuretic be given if there's cerebral edema. There might be IV fluids given to minimize that edema. Blood could be given if they've lost too much blood through a trauma. They're going to want oxygen therapy. Also, you might have to have them under pain control. They might have to medically sedate them into a coma, depending on how severe the brain injury is. And more than likely, the patient's going to have to go through physical therapy when they're all done. They may have to learn simple things over again, like how to use a fork or how to lift up a cup, just because sometimes they have to retrain their body. So a speech pathologist would probably also be involved to do a swallow study. Excuse me, I have a cold. Chest trauma. That can happen with blunt trauma to the chest. It could happen through a motor vehicle accident, through domestic violence. There could be rib bruising, rib or sternum fractures, lung or heart contusions, a collapsed lung, or a death of the tissue if the trauma is severe. Some signs and symptoms would be visual abnormalities of the thoracic region, difficulty breathing, diminished pulse and blood pressure, a low O2 stat, the crunching sound of ribs, and coughing up blood, or it could also be a pink frothy, which would indicate that there is blood in the alveoli of the lungs. Diagnosis and treatment would be something called FAST, which is a focused assessment with sonography for trauma, an MRI, a CT scan, X-ray, possible ultrasound. That way they can check how the heart is working and if it's functioning properly. Auscultation of the heart and lungs. One thing to remember, if an object is protruding from the chest, do not remove it. You could cause more damage. Airtight dressing should be applied to any hole of the chest back area to prevent air from entering the thoracic cage or the thoracic cavity, to prevent collapsed lungs. Give immediate oxygen and always stabilize the head and neck to prevent further injury. Complications would include infection, hospital-acquired pneumonia if the person is laying down, which any sort of trauma that they're going to be on bed rest for, they have the possibility of getting hospital-acquired pneumonia. Collapsed lung could be a complication, and also permanent damage to the heart. Some signs and symptoms would be pain, tenderness, gastrointestinal hemorrhage, hypovolemia, visual abnormalities to the abdominal area, abdominal distension, swelling, or bruising. Diagnosis of treatment would also be the FAST. Something called DPL, diagnostic peritoneal lavage, a CT scan, X-ray, and auscultation of bowel sounds. Your important thing would be the cessation of bleeding, especially if they're internally bleeding. That needs to be recognized immediately. Surgery may be a possibility, especially if they are internally bleeding. Oxygen therapy, medications, and pain management. Again, you want to do the prevention of infection, and you're going to want to do client education like you would with any trauma. Spinal trauma, the causes can be assault, motor vehicle accident, falls, a gunshot wound, or sports injuries. Again, motor vehicle accidents, like I said, have been number one for spinal trauma for many years. Signs and symptoms would be increased muscle tone, loss of normal bowel and bladder function, numbness, sensory changes, pain, weakness, or paralysis. The cervical and neck area, the signs and symptoms and serious complications can occur on one side of the body or both sides, and paralysis from the neck down is possible. The thoracic region, might have blood pressure problems, abnormal sweating, the body may have trouble maintaining proper temperature, and complications can result from the site of the injury down. Lumbar can affect one or both legs, and complications can result from the site of the injury downward, and all of these can cause paralysis. Diagnosis would be a physical exam, a neurological examination, which would be very important, CT scan, a myelogram, an X-ray, electromyography, and a nerve conduction study to see the damage that has been done to the spinal cord. Corticosteroids may be given. Surgery is definitely a possibility. Bed rest, immobilization in order to prevent further damage. Physical therapy will be needed. Medications, pain control, once again, depends on the situation. And complications would be loss of feeling or permanent paralysis, lifelong pain, arthritis, especially if it's a bone trauma to the spine, extreme blood pressure changes, increased risk of injury below the original injury site, that's due to the loss of feeling. So if they cut themselves, they may not feel it and could cause even more of an injury. Loss of bowel and bladder control, increased risk of a UTI, loss of sexual function, pressure ulcers, deep vein thrombosis, lung infections, muscle stiffness, and skin breakdown. And that would be my presentation. Thank you.